Good afternoon. I'm Michael Mallinson from the Canadian Spondylitis Association, and I'm here at the Canadian Rheumatology Association annual scientific meeting, and I'm meeting with Dr. Shirley Tse, and I'd like to just start asking you, Dr. Tse, if you can provide our audience with a short introduction about who you are and what you do.
Great. So I'm Shirley Tse. I'm one of the pediatric rheumatologists at Sick Kids. Dear to my heart are kids who have juvenile spondyloarthritis. So I run a specialized clinic at Sick Kids where we look after patients, I would say within the Greater Toronto area and also within the province of Ontario with this condition. I'm also actively involved with the SPARC, which is the Spondylitis Research Consortium Canada, and we collaborate in kind of advancing the field of research in children with spondyloarthritis as well.
And how common is juvenile spondyloarthritis? How young can children start with it, and how are they diagnosed at such an early age?
That's a great question, and I think most people don't realize that children indeed can get arthritis. So in fact, 1 out of every 1,000 healthy children get arthritis. And amongst all the children with arthritis, juvenile spondyloarthritis makes up 20% of all those kids. So there is quite a substantial number out there. For us, the usual time that kids will present with this is what we call in their tweens or teenage years. But we have some kids that may present as young as between the ages of 8 and 10, probably a little bit more in boys than girls. And so for us, we really identify any children, in that age group that are complaining with a lot of, joint symptoms in their lower limbs or in their back. And I would say those are the kids that we really need to kind of get evaluated by a specialist.
Is there a difference in treatment between children and juveniles with juvenile spondyloarthritis and adults with SPA later in life?
Okay, that's so I would say when we look at inflammation in the joints, we kind of divide it into 2 categories. What I call is in the spine, or what we say in the spine and sacroiliac joint, which is the most common form seen in adults. We usually don't see that when kids present, but that may happen within the next 5 to 10 years as their disease goes along. Kids more commonly present with inflammation in joints outside their spine. So usually in either, I say, their larger small joints, usually in their legs, and that's where I would say we commonly hear kids complaining a lot of, knee, foot pain, heel pain. So in that regard, the treatments, whether it's adult or kids, are the same. We would probably tailor our treatments in treating what we say peripheral joints. So that usually is what we would call is with anti-inflammatories and DMARDs. And of the kids that later on, or rarely, at presentation get involved with the spine, then we also may think of a class of medications called biologics. The only difference for kids is the selection, and also for kids that we would dose it per their size, and that would probably just need somebody who's familiar with dosing in children.
Can rheumatologists handle cases of juvenile spondyloarthritis, or should pediatric specialists like yourself handle such cases?
I think the spectrum for us, because it usually presents anywhere from the young 8 to 10 for us up until their teenage years, it's really to the comfort of the adult rheumatologists. I think they're familiar with the drugs, but really if they're not so certain about the dosing in some of the younger kids or sizes, then I would say in those cases definitely I think pediatric rheumatologists are very happy to take care of them. Because the presentation is really more in the peripheral joints and the spine, that's the only thing they have to probably pay a little bit more attention, because a lot of kids will not have kind of just back pain as their first presenting symptom.
Okay, my last question. Okay. What do you think is the most exciting and important thing from this year's CRA meeting?
There's a lot of great stuff and a lot of great research going out, but I think one of the things I really found memorable this year at the CRA is I think some of the things that they're talking about was motivational interviewing. And I think it's a new form that we as healthcare providers can kind of speak and learn from our patients with engagement and really work as partners together to kind of figure out a great plan and kind of, treating the disease and actually just achieving better outcomes. And I think it was a great, technique that we really learned this time around.
That's wonderful.
Yeah.
Well, thank you very much indeed, Dr. Shi.
Thank you.